Hello, my name is Dr. John Featherstone, and I'm a professor in the Department of Preventive and Restorative Dental Sciences at the University of California, San Francisco. My research life for over 30 years now has been looking at the mechanism of dental decay, how to prevent it, how to reverse it, and how to put that into practice. I want to describe to you the caries balance. This is a very simple concept, but an extremely important one that gives us an overall understanding of dental decay, how it progresses, how it reverses, and how we can stop it from progressing, and how we can manage dental decay in individual patients or in community groups. There are two sides to this balance. One is pathological factors, and the other is protective factors. In terms of pathological factors, we have three key factors. Firstly, the bacteria that cause decay. Those bacteria fall into two groups primarily, the mutans streptococci and the lactobacilli. And those bacteria are particularly important because they produce acids rapidly when they feed upon fermentable carbohydrates. And those acids, which are actually weak organic acids, very readily dissolve the calcium phosphate mineral of the tooth. And that's what decay is all about. And if it goes far enough, it causes a cavity. Secondly, fermentable carbohydrates. These are sucrose, glucose, fructose, and cooked starch, and all the other carbohydrates that you're familiar with, but those are the four primary ones. The bacteria produce those acids, and they'll produce them every time we introduce fermentable carbohydrates into the mouth. So frequency is very important. The number of times per day fermentable carbohydrates into the mouth equals the number of times per day of acid dissolving the tooth. And thirdly, reduced saliva function. Saliva is an amazing material. It has many protective factors that I'll talk about in a moment. If saliva flow is reduced, then we have a major problem because those protective factors are not present, and then salivary reduction becomes a major pathological factor. This can be caused by medications. Many medications reduce saliva flow. It can be caused by disease, for example, asthma. It can be caused by radiation to the head and neck for cancer, and there are also some conditions that people are born with where they have reduced saliva flow. On the other side are protective factors. Firstly, fluoride, that enhances the natural repair of the early caries by combining with calcium and phosphate out of the saliva. That's a major protective factor. Fluoride from any source that comes into the mouth will do that. Secondly, antibacterials. Antibacterials. These have been largely disregarded in the world of dentistry. But obviously, if we apply antibacterials such as chlorhexidine or xylitol, we can reduce those decay-causing bacteria that are part of the pathological factors. And thirdly, and very importantly, a normal saliva flow, which contains calcium, phosphate, natural antibacterials, buffering agents to neutralize the acid, and other proteins that help protect the tooth and help with remineralization. So saliva, normal, is great as a protective factor. And lastly, we can apply another protective factor, namely sealants, for children where the sealants bond onto the surfaces of the biting surfaces of the teeth and inhibit the acid from getting onto the teeth. So in summary, if the pathological factors win out over protective factors, then decay progresses. If we enhance the protective factors, then we can stop, inhibit, or reverse dental decay. So use that in understanding decay, use that in treating decay.